Hello, my name is Dr. Carlo Oller. I am an emergency physician, and I've been putting videos together for patient education in the website PatientEducation.Video. In this patient education video, we're going to talk about hyperemesis gravidum. Hyperemesis gravidum is a condition that causes frequent vomiting or throwing up in pregnant women. Now, vomiting in pregnancy is normal. The pregnancy hormone HCG actually stimulates the emesis centers in your brain, so the higher the hormone level, the more likely you are to get nauseous and vomit. It's the equivalent of morning sickness, but at the very extreme, when it happens too much, for too long, just too severe. Morning sickness is nausea and vomiting that many women have during pregnancy. Even though it's called morning sickness, the symptoms can happen any time of the day. What are the symptoms of hyperemesis gravidum? Well, women with hyperemesis gravidum vomit every day, often many times per day. Women lose weight and get dehydrated from so much vomiting. The symptoms of dehydration include urinating less frequently, having dark or concentrated urine, feeling dizzy when you stand up, that is called orthostasis, and weight loss. Symptoms of hyperemesis gravidum usually start during the first 2 to 3 months of pregnancy, and most women feel better by the middle of the pregnancy, but some women will feel sick the whole pregnancy. How can you find out if you have hyperemesis gravidum? Well, your doctor or nurse should be able to tell if you have this condition by learning about your symptoms, by doing an exam, by knowing the frequency and severity of your symptoms. Are there any tests that you should have done? Well, maybe. Your doctor or nurse might do tests to see if the vomiting is hurting your body, to make sure that another condition isn't causing your symptoms. Just because you're vomiting in pregnancy doesn't mean that it's from hyperemesis gravidum. It could be from other medical condition. So, some of the tests will include blood tests, like looking at your blood count, electrolytes, kidney function. Looking at your urine for degree of concentration, rule out the evidence of infection. And an ultrasound to check your baby's status, make sure the heart rate's okay, fetal movements are good, and maybe an ultrasound of your gallbladder or liver if we think that's causing issues. Is there anything you can do as a patient to feel better? Yes, you can try to control it by eat as soon as you feel hungry, or even before you feel hungry. Eat smaller meals or snack often. The best foods to eat are high protein or carbohydrates and low in fat. These include crackers, pretzels, bread, low-fat yogurt, and nuts. Avoid foods that are spicy, greasy, or acidic, like oranges or sodas. Drink cold, clear beverage, such as sports drinks or ginger ale. Avoid coffee, and also try to drink between meals rather than with the meal. Suck on popsicles or ginger-flavored lollipops. Brush your teeth right after you eat. Avoid laying down right after you eat. Take your vitamins at bedtime with a snack and not in the morning. Avoid things in your environment that upset your stomach, such as stuffy rooms, strong smells, loud noises, or hot places. Have someone make the meals for you. And wear acupressure bands on your wrist. These special bands can help with morning or motion sickness. Should you see a doctor or nurse? If you're pregnant, you must see your doctor or nurse right away if you have any of the symptoms we just discussed. How is hyperemesis gravidum treated? Well, treatment will depend on how severe your symptoms are. If you're dehydrated, if you have lost weight, you will probably need to be treated in the hospital with IV or intravenous fluids and medications to stop your nausea and vomiting. If this treatment does not work, your doctor can feed you through a tube, through the nose into your stomach, or sometimes through the vein, parenteral nutrition. Can hyperemesis gravidum be prevented? Well, doctors strongly recommend that all women who might get pregnant or who are pregnant take multivitamins. The vitamins should contain at least 400 micrograms of folic acid. Taking vitamins before pregnancy and in early pregnancy might help prevent the nausea and vomiting. Will my baby be healthy? Babies born with hyperemesis gravidum for the entire pregnancy are a little bit more likely to be smaller than average. but otherwise the condition doesn't seem to cause permanent problems. Taking medicines for nausea and vomiting due to pregnancy should not affect the baby either, as long as they're indicated and prescribed by your physician. This is the conclusion of this patient education video. I hope you learn about the condition of hyperemesis gravidum, what options you have, what the treatments are, what are the things you're going to watch for, so that if you do develop symptoms, you will seek emergency medical attention. For other patient education videos like this video, go to PatientEducation.Video. Thank you so much. Bye-bye.